Are you a physical therapist or a student interested in knowing how health-related quality of life impacts functional outcome measure? Well, you don't want to miss this one. Stay tuned. Hi guys, Salone here with Expand Excel Physical Therapy and Community Health, helping you expand your education and excel in physical therapy and related professions. On this channel, we interview students and practitioners offering tools, tips, and resources, which can be found in the description area, so check that out. And if you're new here, consider subscribing and spreading the word. But hey, in today's video, I'm with Dr. Lynn Steffes, and she's gonna help us understand how health-related quality of life impacts functional outcome measures. So, Dr. Steffes, can you first just give us just an overview of your background, and then we can get into the questions?
Sure. So I'm a physical therapist by background, graduated from Northwestern University in Chicago over 30 years ago, and then went back and got my doctorate about 10 years ago. Always had an interest in treating neurological patients and patients with chronic health conditions. So did that pretty much full time for 16 years. And then really in the last 20 or so years, I've been involved as a business consultant, working with practices, hospitals, everything from a tiny hospital, a tiny practice to Mayo Clinic. So I have kind of a variety of experience and like a real passion for our profession. But I think the biggest thing I have a passion for is like how we can impact quality of life for people overall.
Awesome. Perfect. Thank you. So can you help the viewers and I understand what health-related quality life actually means? Like, what does that mean?
Yeah. Well, I think that so often when people think of physical therapy, they think of a problem, a body part, a disability, an injury. And they tend to think, well, you go to the physical therapist and they help fix that injury.
Yes.
And the bottom line is, you know, that whether it's your knee, your hip, your back, whatever problem you're having, it could be an injury that affects all of you, or it could be your lack of fitness or problems with balance, coordination, something that you're doing that led to the injury.
Yes.
So it's really hard because we can't treat a body part in isolation.
Yes.
We kind of have to treat the whole person. And I really think when we look at treating the body part, and then we also talk to the person about their overall wellness, their level of activity, are they sleeping, are they managing stress, are they eating right? All of those things translate into a better outcome, not only for their body part, but their whole body and then their life. And to me, that's the difference. That's more important than fixing some little kink in the system. You know, there's a real old-fashioned song, the hip bone connected to the knee bone. And I personally think like the knee bone's connected to the whole body bone. And the bottom line is, as physical therapists are very, we're really well prepared to do that. We just have to step into that arena and start.
Okay. Awesome. Thank you. So in physical therapy, we are always hearing, term functional outcome measures. How does health-related quality of life impact functional outcome measures?
Well, I think right now everyone thinks of that as it relates a lot to the Medicare program. And quite honestly, as of January 1 of 2019, it looks like we won't be doing the FLR G code measures for Medicare anymore.
Okay.
Right now, the draft proposal is that's going to be a change. But the bottom line is that no matter what, healthcare and payment is really going toward what difference are we making in someone's life? We're not talking about difference in their range of motion. Okay. We're not talking about difference in just like a strength measure. We're actually talking about what difference it makes in their ability to do what they want to do every day. And so I feel really strongly that regardless of whether or not we're doing FLR measures for Medicare, that the third-party payment system, along with our customers, which are our patients and our referral sources, their expectation is that we make a difference in their life.
Yes.
And when we start not only fixing an ache or a pain or a local problem, and start really working on mitigating that problem and getting them active, getting them moving again, and work on their overall wellness, quality of life, that's where we really make a difference. That's our value proposition.
Wow.
I think we've been a little bit in a box and limited ourselves and not realize what our real value proposition is.
Amazing. I hope you guys getting some great stuff here. So is there anything I can do, as a physical therapist, that is future tense, to increase my patients, HRQL or health-related quality of life in the effort to improve their functional outcome measures? Me as a physical therapist.
Absolutely. First of all, I think that we have to ask bigger questions. And I always share this, that I have a client in Florida, a clinic that I love, that I think has framed it really beautifully. When their patients come in the door, instead of saying, what body part hurts, or what is your pain level, or what is your complaint, they immediately ask the question, what is it that you love to do?
Wow. Okay.
And so they listen to what is important to that patient, and then they ask, well, what is it that's limiting what you love to do? And so that might be a knee, it might be a low back, neck, whatever it is, carpal tunnel. They address the problem, but then they go beyond that, because you understand, like, if you ask someone, like, if you have 15 degrees and you want 30, that's not an end point. That's not quality of life. 30 degrees will help you get there, but ultimately you want to be able to do what you love to do, whether it's, run a 5K, bike, or it could possibly be, play with your grandkids, or garden, or work at a very physical job, or whatever it is. But the bottom line is that's our focus. Has to be that. So if you're asking me from your perspective, number one, we need to change our intake. We need to change our dialogue with patients. We need to change how we frame why they're there. They're not just there for an ache or a pain. They're there because there's something they can't do that they want to do. And we want to get them there. We can't always get them back to that thing, but we might even be in a position to offer an alternative. But the bottom line is our job has to be from day one, setting the tone that we aren't just like mechanics. In fact, I used to do a newsletter called The Licensed Body Mechanic, and I thought it was really clever, and now I look back and I think it was kind of maybe too simplistic. Then I think we're bigger and better than that. And so I think when you talk to patients, you should ask bigger questions, ask questions over time. A lot of therapists don't document over time what they see a patient, what they can do different at home. Why is that person coming to see you if you aren't making a difference when they leave the clinic? And so I think better questions every single time we see them, really giving patients a vision for what they could and can and should be doing, instead of just saying, my goal for you. So I think it's like a vision in how you interact with your patients.
So go beyond the diagnosis, go deeper beyond the diagnosis.
Because
basically.
you're not treating body parts, you're treating a person, and that person is a whole person. I remember, a couple years ago, I worked with a practice that owns a fitness center and a PT practice. And the husband owns a fitness, or the husband kind of runs the fitness center, the PT runs the practice. And he said to me, I just left my wife and she was treating a woman with severe foot pain who weighed close to 300 pounds. And he said, I understand why she's treating her foot pain, but unless that woman loses weight and has better mechanics and is more active, that foot pain is destined to come back. So I think that sometimes we think doctors should be prescribing exercise and activity. I think we should be. Not just the exercises to get the knee better or the body part, but we should be the ones setting that vision for people. And I love that about what we do.
Well, we are supposed to be the experts of functional movement, right?
Right. And we have lots of partners in that. We have exercise physiologists, athletic trainers, personal trainers, fitness trainers. So we have a lot of partnerships where we can work with them, but there are certain populations that really kind of need our expertise. But we can work collaboratively with all those folks. So
I like that word, collaboratively, because if someone is, scared or kind of anxious about stepping into this realm because they feel like they don't have the information or they don't have the expertise, they can just work collaboratively with those who do. Right? They don't have to be the know-it-all or, jack of all trades, right?
No, that's why we have other people. And it's more fun. I always say, if I'm the smartest person I talk to all day, it's not a good thing. I like working with other people. I like constantly learning from their approaches, and I just think that's part of lifestyle medicine. So.
Perfect. So I guess the last question would be, is there any other tips, tools, or resources you would like to share with a physical therapist that may be watching, or physical therapy student that may be watching?
Okay, first of all, I want to say there are so many resources out there. There are, first I'd like to promote Medbridge, which is a wonderful educational platform very inexpensive subscription-based model for physical therapists and for other healthcare providers. And Medbridge has, we're in the process of building a whole lifestyle medicine series.
Oh, wow.
The first part of the series is already rolled out. The rest of it will roll out over the course of 2018.
Awesome.
So these are courses you can watch, among your colleagues, or you can take them independently in the comfort of your home or a chair on the beach or whatever. I think the APTA has now a Council on Prevention and Wellness, which I think, doesn't cost additional to participate in. I think get involved in that. Look for additional coursework. I have a particular passion in brain health and cognitive health and lifestyle medicine and fitness as it relates to our brains, which we all have. And that program is called BrainyEx, BrainyEx.
The description will be in the description. The link will be in the description area, so make sure to check that out.
And that's that's either a live or a virtual program, all turnkey with all the tools to work with populations. I feel like the MOG, Russ Serto's information is great. Mark Blankenspore and Proactive Health. Stacy Lyons has got some stuff out. I think there's kind of a confluence of energy behind lifestyle medicine right now. I also take a lot of online courses, both paid and free, through the Harvard University Lifestyle Medicine program.
Good.
And that's virtual as well. And they have conferences. So there's a lot out there. And I just love that new therapists are getting so energized with this. And I really believe that, I've always believed this, but I think PTs are the rock stars of healthcare.
I agree.
I think that if all of healthcare chose to really listen to patients, to spend time over time, to help heal them, but also to empower them, to educate them, and to give them things that they need to do on their own to take care of their issues, and then further to prevent further issues, what to do if something comes back, I don't think we'd be in a healthcare crisis. And so I think PTs, we have that role. We are really healthcare coaches already. We just need to see it even beyond what we're doing now. And I really believe the next generation of therapists is going to do that for us quickly.
All right, guys. We have a task. Let's get after it.
Yes.
So
Thank
thank you
you
so much,
so
Dr.
much,
Steffes.
yes.
And I have a question of the day for you guys. What insights, information, or clinical studies can you contribute to this conversation? Connect with us in the comment section where, hey, some of the best tips and conversations are happening. So become a part of the Expand Excel community. Thanks for watching. Don't forget to subscribe and like this video. Remember, all show notes and links to tools, tips, and resources shared are in the description area. So check that out, and I'll see you in the next video.
Sounds good. Thank you.
Are you a physical therapist or a physical... Okay. Take 500. Last one. Turn the mic on. Okay. Here we go. Oh. Today's video, I'm with Dr.
Lynn Steffes.
Lynn.